Good afternoon, and thank you for joining us. And I know everyone has questions about the weather today. The city of Houston is closely monitoring the forecast and reviewing all plans in case we must activate our emergency operations. Meteorologists say Tropical Depression 14 could become a tropical storm or a hurricane before landfall in Texas, and we could see, some rain on possibly Monday, Tuesday, Wednesday. Each weather system is different. You never quite know until it happens. And so while its tracks remain uncertain, I want to remind everyone to be weather alert and to be prepared. And quite frankly, we wanted to have this press conference today on Friday. It's the weekend, and if the storm should speed up, for example, and comes in on Monday, Tuesday, we simply did not want people not to be aware. And so again, we want you to be weather aware, weather alert, pay special close attention to the weather reports, but just do not be caught off guard. Before talking more about our weather precautions, let me talk about COVID-19. Today, the Houston Health Department reports 467 new cases of COVID-19, bringing Houston's total to 59,871. So that's 467 new cases. Sadly, very sadly, there are 17 newly reported deaths as a result of COVID-19, bringing the city's total number of people who have died as a result of this virus to 696. And then, as you can see on the screen in front of us, these are 17 Houstonians. I think one or two of them deaths go back to June. Most of them are in July, and then there are some in August. And then if you'll also take note, again, there are people on this list who are in their early 50s, and their 60s, 70s, they go throughout. So again, this virus is still very much prevalent in our community, and I want to encourage people to exercise all of the necessary precautions in putting on your mask. While hospitalizations are down, the overall number of positive cases and death remain too high. And the number of hospitalizations in our city of Houston hospitals in the region is down. A few weeks ago it was 2,400 or so. In our hospitals, when I looked at the numbers this morning, it was under 1,000. And I know people are tired of COVID-19. I am tired of COVID-19. But the reality is the virus is still here. There are far too few people that are testing. We were doing a fine job in May and June, so much so that the question was, how are you all? What are the plans to increase capacity? Well, we have increased capacity, and there are testing sites all over. And as we have increased capacity, people have they have stopped going to the testing sites. So let me urge people to muster up the will, to find the desire to go and get tested. And this is not a Houston phenomenon. It's happening all across the country. But let me just say to you, as you can see, 17 Houstonians have died. They've been reported today. So this virus is very much prevalent. To people, for example, in all of our communities, especially our vulnerable communities, communities of color, let me encourage you to go and get tested. That's especially important. So if you love yourself, and if you love others and your family members and friends, I implore you to take advantage of one of the many free testing sites in the city of Houston. We ask no questions in reference to your status, whether you're documented or undocumented. It does not matter. We simply want you to be healthy and want you to be safe and want those around you to be safe. If you feel sick, you should not wait to get tested or to see your doctor. So please don't just, stay there, stay home. If you're sick and you're getting worse, please seek medical attention. Please continue to wear your face mask, maintain your social distancing, wash your hands to slow down the community spread. And as we respond to the pandemic, we're also preparing for the possibility of a storm in the Gulf that could impact the Houston region. This coming week will be the 3rd anniversary of Harvey. Interestingly, I started to be 3rd anniversary, 2 weather systems potentially in the Gulf. Isn't that something? And so we don't want anyone not to be prepared. I've asked all City of Houston departments to review their plans and prepare for a community-wide response by making sure they have in place everything they need. We are in hurricane season, and Houston knows how to prepare. We've been battle-tested several times, many times, but the COVID-19 pandemic creates some additional challenges. And so in addition to your hurricane preparedness kit, please put a few other things in there. And that is your mask, at least 2 or 3 in your mask, some sanitizer or soap, however you want to use it, do it. But there are some additional things you need to have as a part of your hurricane preparedness kit. We have plans in place to protect the public's health and safety. That includes requiring members of the public to wear masks if we must open shelters and disinfectant spaces where people gather. Our first responders and public works employees will be wearing their PPE, personal protection equipment, as they stage equipment and vehicles to prepare for the storm. If by chance we need, the George R. Brown will be one of our staging areas, like an evacuation hub, so to speak, if needed. There'll be additional shelters, the possibility of using hotel rooms. To the extent we need them, we are preparing for the worst, hoping for the best. But there are some modifications to our whole preparedness plan as a result of the pandemic, because we still intend to practice separation, and we still will be intending to do the COVID checks and to spread people out. And so again, this is one of the times where you may have to be encouraged to shelter in place or shelter with family or friends or neighbors if it is needed. And as an example of how the City of Houston departments will assist in the event of heavy rain or high water, HPD will provide water rescues and block flooded roads. HFD will conduct water rescues. Public Works will provide barricades, high water trucks, storm drain monitoring, and assist with clearing trees if needed. Solid Waste will monitor debris and have contracts in place if needed. And so the point is, we've been through this exercise before. I think we all know what to do. These are gentle reminders as we are getting prepared. It is important for you to get prepared, and we want to make sure that you know that there are systems that are approaching, and so please be weather alert. Now let me call on first Chief Buenik of the Office of Emergency Management.
Great. Thank you, Mayor, for your leadership during COVID and also for your guidance during this hurricane season. The Office of Emergency Management has been working closely with all of our partners, and that includes the men and women of the Office of Emergency Management, the Houston Emergency Center, my partners up on stage here, the Houston Police Department, the Fire Department, Public Works, and then some private sector partners like CenterPoint Energy and the Red Cross in the event that we have to open up some shelters. The Office of Emergency Management will be issuing alerts and weather updates through alerthouston.org. That's alerthouston.org. We encourage everybody to sign up for alerts so you'll be kept up with the most updated information. Our message is also during hurricane season, is to make a plan, build a kit, stay informed, know your neighbors, and more importantly, neighbors helping neighbors. We know during these times that there's some elderly folks and vulnerable people out in the community that are living in neighborhoods. So we're asking at this time for people to go out and help those in need. We also encourage people to download our disaster preparedness guide. It can be downloaded at houstonoem.org. It's available English, Spanish, and 4 other languages. It provides checklists and all kinds of good information to help you prepare for the hurricanes. The last piece of information I'll give you, well, 2 pieces. One is our slogan, "Turn around, don't drown." While we're not expecting a lot of water during this storm, it could be. We don't know at this time. We'll be getting some more information and updates, so we'll have a better idea Sunday going into Monday exactly what type of storm it's going to be and potentially how much water. But turn around, don't drown for high water. And then also I'd advise people to call 311 if you see some storm sewage that are clogged, and for people not to be leaving their garbage bins out for garbage pickup between Tuesday and Wednesday, because that'll prohibit the flow of water into our storm sewer. That's it for the updates. Thank you, Mayor.
Thanks, Chief. Chief Pena with the Fire Department.
Thank you, Mayor, and thank you for your leadership. I would like to first begin by giving you a quick update on Captain Persse. He is still in ICU. He's a tough individual, and he is fighting this. We're hopeful that the experimental medication that he's been given is positive. So please keep him and his family and the rest of the fire department and first responders in the city of Houston in your prayers. Today we're finalizing our logistical planning in anticipation of next week's weather. For us, that includes ensuring that we have enough supplies at the fire stations, that we're securing the fuel, proper equipment, and doing all the operational checks for our high water vehicles. In addition to that, we're coordinating with our partners, as Chief Buenik mentioned, OEM, the Health Department, Police Department, Public Works, all the other city departments that will be out there serving this community in case we do experience a heavy rain situation. What I'd like to remind the public is, as was mentioned earlier by Chief Buenik, it doesn't take a lot of water for it to cause some issues for us, especially on the streets. Do not drive through flooded streets. It doesn't take but 18 inches for your car to be swept away, and we've lost too many people because people are driving through these flooded streets. If we have a power outage, again, we want to ensure that you have your generators, flashlights, batteries, everything in place in case we have a situation where we lose powers. Do not use grills. Do not use your generators inside the home. They cause carbon monoxide that can be deadly. Keep your cell phones charged. If you certainly if there's a degradation of the cell service, remember that texts a lot of times will go through when the phone calls will not. So we'll have more information as the days go on. By Sunday, we should have a better understanding of what the impact may be here in the Gulf Coast and certainly for Houston, the Houston area, in regards to the weather. And we will ensure that we have our personnel out in force. We have some very motivated and highly trained individuals that are ready to deploy. We have all our high water assets that are in service right now and will be ready to deploy if needed. But as has been mentioned here before, when we work together, we're all a better community. So let's do our part, ensure that we're making the proper preparations for ourselves, for our families, and that includes your pets as well. So thank you.
Chief Acevedo, HPD.
Good afternoon, Mayor. Thank you for your leadership and for having us. My prayers go out to Captain Persse still, and hoping that he'll recover. I'm going to give you a quick update, Mayor, on where we're at with our COVID-19 impact on the department. First and foremost, we're fully operational, capable to respond to any event, including the weather events that we're anticipating. We have 103 of individuals right now that are quarantined at the Houston Police Department. The year to date, we have 472 that have tested positive, and thankfully we've had 389. Let me just say this, so the 389, sadly we've had 2 deaths, and I want to just reemphasize that even the folks that have returned to work, has been described time and again as a horrible experience, something that they've never experienced, and these are people that, for those that think it's simply the flu, it is not simply the flu, and it's very important that we all be aware of that and that we continue to wear our masks, socially distance, like the mayor says, and to utilize common sense. We've had to issue about 15 warnings, and so far, thankfully, we've only had to issue 2 citations. Because Houstonians are better than most communities, we do things as the right thing, not because we have to do it. And again, Mayor, I thank you for your leadership. As it relates to the weather event that's coming, Mayor, we just got off the phone with all our command staff across the city. We have put our department on an alert posture that will begin Monday. We have 10 high water rescue vehicles that are already fully deployed across the city. We have 10 others ready to deploy that will be staged starting Monday afternoon, and that will be ready to deploy to wherever any hotspot hits. We also have about 20 boats ready to deploy across the city, including our flat bottom boats in Houston, on Lake Houston, that will be out there for rescue and ready to go. And we will be monitoring the waterways in the port area with our port unit. The last thing I want to say to folks is that we don't know what will happen next week. We are monitoring with Chief Buenik and everyone else. But we have talked to our federal partners that will be, once again, like Hurricane Harvey, we will be utilizing our federal partners to keep an eye on pawn shops and pharmacies and on gun stores. You may not see police officers. You may not think that these places are being watched, but they will be watched. And if you try to, if in a worst case scenario we end up with flooding or widespread loss of power and extensive hours of loss of power, do not think that these places will be left alone. There will be eyes on these places, and if you try to do any of those things, you will be arrested. And lastly, turn around, don't drown is not a slogan. It's a way to stay alive. Every Houstonian that's been here knows where the low water crossings are at. They know where the problems are at, and we just urge you to stay off the water once this storm hits, if it hits in our area. But we will be ready. And again, Mayor, I thank you for putting the community on alert. And we're ready. And as always, we'll rise to the occasion. Y la comunidad en español, acuérdese que esta tormenta es una posibilidad que el lunes venga la tormenta. Le quiero dar las gracias al alcalde Turner y a todos mis colegas, el jefe de los bomberos y el señor Buenik. El departamento de policía está listo, los bomberos están listos, vamos a tener bastantes unidades para poder proteger y rescatar a nuestra comunidad. Pero lo más importante es que sepan, que pongan atención a lo que está ocurriendo. Si hay cualquier, si la tormenta llega aquí y hay alguna inundación en la carretera, por favor no lo cruce. Como dijo el jefe Pena, que da más que 18 pulgaditas de agua puede llevar su automóvil y puede ahogarse. Por favor, no tome chances. Prepárese, prepare a su familia, tenga sus alimentos, tenga su agüita, tenga todo lo que necesita. Si perdemos la electricidad en la comunidad y al fin del día, no tenga temor. Si necesita llamar por auxilio, no tenga temor al Departamento de Policía de Houston o nuestros colegas en el Departamento de Policía de Bomberos de Houston, porque aquí no estamos para la inmigración, aquí estamos para el rescate y la seguridad pública. Y la última cosa que queremos decirle es que tenemos más de 472 miembros de nuestro departamento que han cogido el COVID desde que empezó y 2 fatalidades, desgraciadamente. Por favor, sigan poniéndose la máscara. Muchos de los que vieron, de los 17 que murieron, la mayoría son hispanos. Por favor, tomen este virus seriamente y hagan lo que nuestros médicos dicen que tenemos que hacer. Eso es todo lo que tengo que reportar. That's all we have to report, Mayor. Thank you. And one last thing, we will continue to work every minute of every day between now and then to make sure we're ready.
Thank you, Chief. I'm not going to repeat those things in Spanish since you did that, so I'm just going to move on to the next part of my report, since you already did that in Spanish. Let me just say that as the storms come, the virus does not take a break, okay? So let me repeat that. As a storm comes, the virus doesn't take a break. Let me encourage you, for example, instead of waiting for Monday, Tuesday to get tested, go today, go tomorrow, go Sunday. Minute Maid parking lot, that testing site remains open 7 days a week, 8 to 4 o'clock. Go to any of the other public testing sites today, tomorrow, Sunday. But don't wait. Do it now because it's important for you to be tested. And so let me now bring Dr. Persse to talk about where we are.
Thank you, Mayor and Chiefs. praying for Captain Searcy. One update to have is the mayor pointed out about the testing numbers are going down, and testing is vital for all of us. It's vital for us as a community to have a sense of what the viral activity is in the community. It's also vital for families to make sure that you know what's going on in your family. And so I told you that this week I was going to get tested, and I did. I went yesterday, and when I arrived, it was in the 1 o'clock hour, so midday, maybe a little bit late for lunch. But, you know, midday, I was the fifth car. Mine was the fifth car in line. I think I was in the parking lot at Minute Maid for no more than 15 minutes. I got on, got brought right up. I was the fifth car in line. They moved us through the process of being asked a couple questions to make sure that I had, you know, the verification number and all that. And then the swab was very, very quick, and I was on my way. So I don't think I was there for more than 15 minutes, and I was the fifth car in line. So for people who are afraid to go, or concerned, I should say afraid, but concerned of going because of long lines, that is simply not the case anymore. The testing capacity the mayor referred to has gone up to the point now where there are very, very short lines. The online registration is very, very easy. And we have many, we've talked about, and we've had the screens up about the 5 mega sites that can do thousands of tests a day. But remember, throughout the city, in neighbors, there are 15 at least neighborhood testing sites. So when you add those to the 5 mega sites, that's 20 different locations in the city of Houston where you can get tested for free and easy and quickly. So people should really consider that. And then the other thing is, I want to remind folks, in fact, a member of my own family asked me, well, you know, is it dangerous to go to the testing sites because people who have COVID may be going there? And while people who have COVID may be going there because they're concerned and stuff, when you go through, the processes are such that you don't get exposed to anyone. If there's, the only people you would be exposed to, whoever is in your car. Because when you get on location and you talk with the folks at the testing, they are many feet away from you. In fact, if they have to hand you things like the swab, they have a big long stick with a little grabber on the end, and they hand it to you, and you do it from there. So you don't get close to anyone. So they are extremely safe, and it's extremely fast and easy and free. So we really encourage folks to go ahead and get tested. The other thing is to remember, to remind folks that if you're sick and if you have symptoms, contact your healthcare provider early, and when it comes time that you may need to go to the hospital, do not be afraid to go to the hospital. The hospitals have become very adept at keeping everyone there safe. So if you need to be there, please go in early. Don't wait until you're so sick that the doctors and the nurses have a real challenge in getting you healthy again. So go, contact your doctor, talk to your doctor, figure out, is this something you should stay home, or no, it's now time to go to the hospital. If it's time to go to the hospital, please don't be afraid to do that. Conversely, with the storm coming, let me remind folks that hospitals are not shelters. And we've had this happen in previous storms where people will go to a hospital seeking shelter. Well, that was inappropriate before, but I can guarantee you that is not going to happen this time. The hospitals are not going to function like shelters because they're not going to allow people in the building who may, have the virus unknowingly have the virus. So again, to the point that Chief Buenik made about planning, have a plan, have a kit, make a plan, be thinking ahead and recognize that hospitals are safe places to go if you need to be there, but they are not to be used as shelters. We have other ways to manage those issues. Mayor.
Yes, yeah, I was going to do it, but you come on and do it. No, you come on and do it.
Thank you. Voy a repetir lo que dijo el doctor Persse en español. Primeramente, lo que dijo el alcalde, comenzando esta conferencia de prensa. Estamos monitoreando el sistema que está en el Golfo y estamos haciendo preparaciones en anticipación de lo que pueda pasar acerca de lluvias a causa de estos sistemas. La ciudad de Houston está preparada, el departamento de bomberos, de policía, otros departamentos de la ciudad de Houston están preparados para poder responder y todas las preparaciones se están haciendo ahorita y van en pie. A lo que estaba comentando el doctor Persse es que les urgimos, especialmente a las comunidades hispanas, a las comunidades afroamericanas, que vayan y se hagan las pruebas del coronavirus. Hay 20 sitios donde pueden acudir a hacerse estas pruebas. Las pruebas son absolutamente gratuitas. No les van a preguntar preguntas acerca de su estatus migratorio, nada de eso. Es importante que nosotros acudamos a estos centros para poder tomar las pruebas y ir a los doctores si estamos positivos y tenemos síntomas. Lo que estaba comentando el doctor Persse es que los hospitales están seguros. Muchas personas creen que yendo al hospital ahí van a contraer este virus y eso no es verdad. Los hospitales están haciendo todo para proteger a sus pacientes, para proteger a los doctores y a los que están ahí acudiendo a estos sitios para enfermedades. Lo que queremos comentar es que estos centros, si hay un incidente de bastante lluvia o inundación, que los hospitales van a estar abiertos y van a estar recibiendo personas, pero no son albergues. ¿Okay? Antes ha pasado cuando hay sistemas, cuando hay problemas de inundaciones, que muchas personas acuden a estos hospitales creyendo que ahí pueden estar seguros y usarlos como albergues. Eso no es el uso apropiado para esos hospitales. Muchos de ellos no van a dejar que entren las personas para protección de los pacientes y de los que están dentro de estos hospitales. Así es que es muy importante que se hagan las pruebas, si tienen síntomas, que acudan a sus doctores, si es un problema serio que tenga que ir al hospital, acuda a los hospitales. Si ocurre un incidente donde hay inundaciones, los hospitales no son albergues. Quiero repetir eso porque hemos tenido situaciones anteriores donde muchas personas van a ir nomás para protegerse de las lluvias. Queremos que esta comunidad esté segura, que nosotros estamos haciendo todo lo que tengamos que hacer para prepararnos, para poder responder adecuadamente a cualquier sistema que pueda entrar al Golfo y que nos impacte aquí en Houston. Gracias.
Thanks, Chief. And then lastly, Houstonians with disabilities should register today for the State of Texas Emergency Assistance Registry. That's STEER, S-T-E-A-R. STEER assists our first responders, the Office of Emergency Management, and the Mayor's Office with people with disabilities to plan safe, accessible evacuations and communications for people with disabilities should they be needed now or in the future. So we want to make sure we don't leave out anyone. So people with disabilities, we're asking you to please register today for the State of Texas Emergency Assistance Registry. That is the STEER program. And then bear in mind, for those of us who live along the Gulf, it is especially important for us to get tested, and let me just tell you why. Because if you end up having to, let's say, shelter in home, or bunk with family members and friends, or potentially go to a shelter, you really need to know your COVID status. You really need to know. So for those of us who live along the Gulf Coast, it is critically important during hurricane season for us to get tested. And quite frankly, it would be selfish on your part not to. And then you end up having to go to a shelter or go to other family members' homes or to friends, and you don't know your status, and potentially could cause even greater problems during the course of hurricane season. So please get tested, and then bear in mind, we have Captain Persse, who is battling and fighting courageously for his life and to recover from this insidious virus, COVID-19. So we want to continue to pray and lift him up, as well as his family, but to lift up Captain Persse. And so while he's battling, it really doesn't make a lot of sense for those of us who are not in hospitals, who have not gotten tested, who don't know our status, not to take advantage of one of the many free testing sites that exist in the city of Houston. If you don't do it for yourself, do it for the first responders, do it for other people who are having to meet your needs, and they need to know your status. So let's do that. Thank you all so very, very much.